Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health on Power 96.5 WUFO. You might want to know, or you might think to yourself, who is Kaleida Health? Well, Kaleida Health, we are the hospitals, Buffalo General Medical Center, Oishei Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban, the Visiting Nursing Association, which is open 24 hours a day, 24 hours a day, 7 days a week, and it serves the needs of all ages, babies all the way through the eldest member in our community. We have DeGraff Medical Park, and we also have DeGraff Medical Park as well as DeGraff as a nursing facility. And we also have High Point, which is also a nursing facility, and long-term care. Both are long-term care, rehab, and nursing facilities. We have clinics. We have adult clinics on Hurdle Avenue. We have children's clinics, one on Niagara, that's Niagara Peds, as well as one on Broadway Avenue. And then one on Broadway is across the street from the Broadway Market. We have women's health centers, one health center for women on Kensington Avenue, as well as one on Niagara Street. If you're interested in visiting or I should say viewing or sharing with your friends, colleagues, students, classmates, any of our videos of our past recordings, please visit www.kaleidahealth.org/videos. And when you click on that, you will see 3 years, maybe even 5 years worth of past interviews, which are all factual and can be utilized for just about any purpose. And Kaleida Health is available for outreach, job, career fairs, health fairs, speaking engagements, and both can be either in person or virtual. So you know what we're going to start right now? I have a little more to say, but what I'm about to say, I'll save that for the end because I want to get to our interview. Our interview is with one of our community partners. What is a community partner? Well, a community partner is someone that Kaleida Health works closely with. They're not a hospital. They're not a clinic. They're a community partner. We work very closely with the Buffalo Urban League. And the Buffalo Urban League, the Project Hope, they're members of the Near East and West Side Task Force. The Near East and West Side Task Force is supported by the Buffalo Urban League. And today, the topic is something that, oh my gosh, we hear in the news more than we really want to hear in the news. But we hear it in the news because it's a real concern throughout our community and communities across America. And what is that? Behavioral health. Today's topic is behavioral health through the lens of children and as adults. And our guest this morning is Melissa Archer. Good morning, Melissa.
Good morning. How are you today, Miss Fran?
Good. How are you? And Melissa is a nurse practitioner, and I'll let her tell you everything in her initials. But she's also the Chief Operating Officer at the Buffalo Urban League, and she's also the person responsible for making sure that the Project Hope, which is what our topic is talking about today, behavioral and mental health, when there's a request for Project Hope, part of the Buffalo Urban League, Melissa Archer has, they have, not Melissa has, but Urban League has, they have counselors, and I think they speak like 5 or 6 different languages, and they are there for the community, in the community, to meet the needs. Is that true, Melissa?
True and some. Thank you.
Yeah, and some. and Melissa, if you could just share with your listeners, I know you're a nurse practitioner in mental and behavioral health, but what are your initials? If you could share with us your initials.
Oh my goodness. So the initials are, it's, I'll just say them first and then explain them. It's PMHNP hyphen BC. So all that means is this, we spent a lot of money on our education, but no. What that means is psychiatric mental health nurse practitioner board certified, which means you start out as an RN, you work at least a year, and then you go to school, back to school for a master's program in psychiatry and mental health. And then there's licensing and board certification to make sure we're on the up and up. And then we can provide services to patients. And what do nurse practitioners do, particularly in psychiatry? We can diagnose, we can prescribe medication, and do counseling as well. And in every state has a different mandate in terms of your collaboration or corroboration with the physician. And we in New York State, it's you have to have a collaborating physician for the first 3,000 hours, I believe, of providing patient care, and then you have a little bit more freedom, but you still need to have a physician to kind of, collaborate on cases if needed. So that was a lot.
Thank you. It is a lot. You
Yeah,
know
that's a
what?
lot.
And I didn't know if to call this mental health, behavioral health. Is there a difference in the two?
I know, mental health and behavioral health are used interchangeably a lot.
Yes,
And excuse me if I talk really fast because I do get excited about this
I
topic. So
know.
I'm definitely trying to monitor myself. But behavioral health has more to do with like how people behave and their actions, and how they respond in different situations. Where mental health is more concerned with like your thoughts and your feelings, which enhances or informs our behavioral health. So there is a slight difference, yes, but those two terms are used interchangeably in many communities.
Thank you. And how about
Mm.
okay, Project Hope? As we talk today's topic about behavioral health through the
Mhm.
lens of children and adults, and the reason I say through children and adults, because we hear so many times about children who are now. It used to be kind of uncommon to hear about children getting caught up in either trauma in the home or violence in the streets, but now unfortunately it's almost every day, and that's
Mhm.
why I'm talking about both areas, because a lot of times we talk about adults and mental health, but we don't really talk about children. So how about if you could share with us some of the services that are provided by Project Hope, and is Project Hope a part of the Buffalo Urban League? I just wanted to double check.
Yes. It's so it used to be called New York Project Hope, which ended last year, and it was a crisis counseling program wrapped around servicing community members in Erie County at the time around COVID. But then the 514 Tops massacre occurred, and we serviced folks in around that tragic event. December 12th of this year is December 12th of last year, excuse me, it was a FEMA funded, federal funded program. The COVID crisis was no longer considered a crisis, but the program did so well in servicing the community that the Office of Mental Health took over this program, and now it's called Buffalo Hope. And it's an acronym, helping our people equitably. So we help Buffalo, it's for Buffalo community members, where they can walk in at two of our sites, 1359 Jefferson, and then we are also over at 1021 Broadway. And we also have a helpline that they can call between 8 and 6:30 Monday through Saturday. And that program, which is one of the programs of the wonderful Buffalo Urban League, provides services like we have a helpline where you can call and speak to a community mental health worker, and they can provide an intake to see what services you need. And those services can be in the form of emotional support, individual group sessions, virtual, online support groups, any resources, linkages, any wellness activities that we provide as well, tablings. And we also provide financial resources for short-term needs like food and housing, household items or clothes, whatever the intake form kind of shows is the need, we try to provide. And so it's for any Buffalo community resident. And you did say we speak 5 languages, and we're onboarding new folks. And with that will come, that number will go up to about 10 different languages that we will be able to provide. English, Spanish, Taiwanese, Chinese, Arabic, Hindi, Bengali, Urdu, Japanese, and French. And
Okay,
always looking to diversify it more.
that's really important. So if you could tell us, what are those languages again?
Right. In the next 2 weeks, definitely. English, Spanish, Taiwanese, Chinese, Arabic, Hindi, I hope I said that right, Bengali, Urdu, Japanese, and French.
Mm-hmm. Okay.
Mhm.
That's quite a bit, but you know what? That's a reflection of our community.
Absolutely.
And so you're saying if let's say someone listening to this is servicing clients with that who speak one of those languages, how would they get in touch with you?
Mhm. Oh, our helpline number is 716-250-2478. And there's always somebody on the line between 8 and 6:30 p.m. Monday through Saturday.
And I'm going to have you say that the phone number and the hours again, if you could, please.
Absolutely. 716-250-2478, Monday through Friday, 8 a.m. to 6:30 p.m.
Thank you.
Mhm.
Now, can someone during the office hours, does one need an appointment, or can they just walk in off the street?
Just walk in off the street.
Okay.
No
And
appointments
then
needed. Mhm.
and then what happens when they walk in? So give me an example. I'm coming in, I walk in off the street. What happens?
Well, you will be warmly welcomed, of course. And at that point, we will ask, what is the need? Sometimes people come in, they just need directions, or they just want to come in and see what we offer. If it is identified that they feel like they need services, we ask them, give them a preference, right? We're first of all, we see, what language they speak. If it's not English, or would they feel more comfortable, speaking in their native tongue. And then match them up with a community mental health worker so that they can, start an intake. And then from that intake, decipher like what is needed, and then start that process to get them what they need. Whether it's a resource, a linkage, financial resource, emotional support, whatever the case may be. And we have a vast a plethora of resources available to us internally from the Urban League and externally with all our community partners. So what we internally cannot provide, we will definitely provide that linkage to make sure that they can get what they need. And then not just give them a phone number either, walk with them, with that path to make sure they get what they need.
Mm-hmm. Mm-hmm. Okay. Okay. So now with summer, and let's say the adult is now home with the child and spending more time, even if it's just because the child doesn't have to leave and go to work. They're spending more time with the child. And let's say the child isn't going to summer camp, but the child is just home. What can parents do? What can that caring adult who is home with their parent do to make sure that their child is maintaining good mental health and well-being?
Definitely in my wheelhouse. Love this. Yes, question. So parents, school provides that structure and routine typically. The caregivers, most of us have to work, right? So the child may be in a camp or, be with a trusted caregiver. And summer is more of a relaxed time for kids, right? But you still want to provide, if they're not in camp or if they're, not in summer school or something like that, you still want to provide, you still want it to be a relaxed time because they've worked so hard for the past 10 months while they were in school, and summertime is a time to be outside. But you still want to have some structure, some routine of what time we get up, maybe what time we go to bed, what time we eat breakfast, lunch, and dinner, things like that. But just having, some kind of semblance of some kind of routine, but some fun time structured in there. Now, for caregivers that are at home with their child, It's very important for that social, emotional, behavioral well-being of children and youth, very, very critical for our human development. That kind of lays the foundation for everything, lifelong learning, our well-being and things like that. And, how do we continue that, past, them being in school and things like that. So just, I was watching something the other day and it said 3-3-3. The 3 seconds your child first, the 3 minutes after your child first wakes up, the 3 minutes before, they come from school or maybe come from camp, and the 3 minutes before they go to bed. Very critical. Time to spend that time, love them up, tell them how proud you are of everything they've done that day or what they will do that day. And really just really investing in your child and that positive messages that we're giving to them. And, spending that time, having some structure, not completely structured, but having some structure and then building in some fun activities, going for a walk, teaching them that self-care, the caregiver should be doing themselves, but, doing things with them and some structured activities, we want to keep their brains still going. Don't want them to lose, what they learned for the past 10 months. So, like I said, just building a structure, maybe even making a little schedule, to get real granular about it. They get up at 8, give them that love, and, breakfast, brush teeth, get dressed, make your bed, maybe go for a walk, play outside, and then maybe do some reading and then some free time. The screens, they say no more than 2 hours a day. Let the child decide, give them that agency and that empowerment to decide when they want to take on that screen time. And then, eat lunch, afternoon, maybe go for a walk, do a puzzle, just really creating those activities that are going to engage them and, not just keep them busy, but engage them and keep them active while you're teaching them as well. Now, to be able to do that, the caregivers must take care of themselves first. I'm a big proponent.
Right. And that's another one. That's my other question is about the caregiver. And what if the caregiver is feeling stressed and how to reduce that?
Yes. So, when you're a caregiver, you cannot pour into your child's cup if you don't have anything in that cup. So, just like when we're in, you're going through the safety briefing on an airplane, and they say when the oxygen mask drops from the ceiling, you have to put it on yourself first. Because if you do not, and you're fumbling to put it on, the passenger next to you or your loved one next to you, and that doesn't occur, then both of you are down. So you have to really take care of yourself first. And it's not being selfish. It's not, I've heard people say, oh, self-care is selfish, or, me going for a walk or journaling or taking time for myself is selfish. It's not. It's actually selfless, right? Because by you pouring into yourself, you're actually pouring into anyone that you engage, whether it's your family, your community, your neighbor, whomever that you engage on a daily basis and pour into. You have to pour into yourself first. So for the parents, I always say get up before the kids do. Get up before the children do, so you can have that time to kind of just, the house is silent. You got a moment to just okay, take a breath, plan the day out if you didn't the night before, and just, get some bearings. And in that time, you can, watch a little TV, whatever self-care that makes people, happy. And self-care is not just going to the doctor, which is very important, but it's really doing something that you enjoy doing every day, every other day, whatever your time permits, so that you can lower the temperature of the everyday grind, so that you can take care of yourself. And then once we are emotionally and mentally kind of in a more even, less stressed state, we can deal with the challenges of every day. We can deal with, if we have a 2-year-old that decides that, they're going through their terrible twos and everything says no. You're hungry? No, as they're stuffing food in their mouth, you can deal with that, you can deal with the challenges of, just life in general and whatever else is going on. So, the parents, like I said, they can, do whatever they can do that makes them happy, whether they have 5 minutes or 50 minutes. It can be journaling. It can be watching TV.
What's journaling? What is journaling?
Yeah. Journaling is just writing down your thoughts. And it doesn't have to be a fancy journal. It can be from the Family Dollar store. It can be a piece of paper, but just writing down your thoughts and feelings and pouring out to pouring out what you're feeling and thinking, because you may not have somebody to talk to. Sometimes it's good to write it down because it's your thoughts and it's yours, and you can put it under your pillow or under your mattress and it's yours, and then come back
Mhm.
to it. And what I like about journaling, I've been journaling for a while, is like you can go back years, right? And see where you were and look at the progress you've made, or maybe look at the progress that where you were and where you want to be. And it's just kind of good to have somewhere where you can put those words down. And also for me, it's like you can see it. It's like a physical manifestation of what's going on inside my head or what's going on inside my heart, and you can just get it out on paper. And it's, we're gonna shelve that for right now, so I can go and enjoy my family. But there's so many different things, and I would encourage folks to go to SUNY at Buffalo UB's Department of Social Work, and they have a wonderful self-care assessment toolkit that you can take and then write a self-care like plan for yourself.
But what if, okay, but what if someone doesn't know how to, what if someone doesn't have the internet and they can't go to UB? I mean, are these materials available at Project Hope? Can someone go there?
They can come to us and we will download that information. We will talk about self-care over the phone. We will do that emotional support. But that is a resource that we utilize extensively. So we would get that information to the person, whether we have to bring it to them or if we have to, we have to bring it to them, or they come to us for one of our programmings or support groups or things like that. But we definitely will get that to them if they were open to it.
Okay, and if you could just what is the address again?
1359 Jefferson, the Buffalo Urban League Buffalo Resource Center, and then also at 1021 Broadway in the Jericho building.
Okay,
and we also have the helpline as well.
All right. Okay, so I just want to, and your office hours again are
8:30 to 6. No, excuse me, 8 a.m. to 6:30. Monday through Saturday.
Okay, Monday through Saturday. And what if what if it's after in the evening? Is there some type of a crisis line that they would call?
What happens though, if somebody does call, we will call back. They have the option of our message will say, call 911, crisis services, if they're needed. And then, if they left a message and we listen to it, I know I have called folks back like, oh, we got to jump on this right now. Mm-hmm. But we do give them another soft landing that they can, call 911 or crisis services.
And can I say, for anyone who doesn't know Melissa, those are her words. We need to jump on this right now. So I have to say, Melissa, I know you, and she's serious. She will stop everything and jump on it. So what are we only have a few minutes left. What are some signs of a child and an adult, like a couple of signs if you see your child is getting stressed, because we know suicide is real. Mm-hmm. And what are some signs if we know adult is feeling stressed?
Right. So the initial thing you need to be aware. Mm-hmm. The initial thing is knowing who you're dealing with, right? So you got to know the temperament of the child and temperament of the adult initially to know what deviations there are. But like, say if somebody is sleeping more or less, eating more or less, they're not meeting, your eyes are not as communicative. They don't want to, for children, they don't want to come out of their room. They're extra grumpy. They're not as social. They're pulling back. And it's not because they're hungry or because we got to look at all those first. If they're hungry or they're tired or they're not feeling comfortable around a certain person or something like that. Once all those things are taken care of and you're still seeing these kind of symptoms, and especially with children, they have what we call like a lot of psychosomatic symptoms, which are more like, I have a tummy ache, I have a headache, when it really could be a sign of they're dealing with something, they're stressed out. So you really have to be in tune to know their baseline so you know when there's a deviation. Crying a lot, maybe angry outbursts, and that's not their norm. And what you can do in those instances, we need to reach out. You can definitely if you reach out to Buffalo Hope, they definitely will, once they do their assessment, see if there's something more of an emotional support thing, or you need a licensed professional, mental health professional, and they will give you that referral as well. With adults, it's almost the same. They're sleeping more or less, eating more or less, become withdrawn, don't want to engage. And, say if you got somebody that's really, really bubbly and all of a sudden they're mute, they don't want to talk, they don't want to be bothered with. There's probably something going on that's stressing them out. And those are just some of the symptoms, and depending on the whatever's going on, or even the diagnosis, if it is something that's diagnosable, that's why they do assessments, extensive assessments to licensed professionals to determine, what are the symptoms. And then also we look at the duration of the symptoms, what exacerbated it, what relieves it, things like that. And with that, that kind of determines if there's a need for psychotherapy, psychomedication, and or both. And that's okay either way. There's no stigma behind getting the help that we need. If I scrape my arm or I break my leg, I need to go to the doctor to get it fixed. If I'm feeling emotional, not emotional, but I'm feeling depressed or anxious, or some things just not feeling right, I'm hearing voices, I'm hallucinating, it's okay to reach out. And there's always somebody on the other end to help you.
All right. And Melissa, on that note, I just want to say thank you. And this is Melissa Archer with Buffalo Project Hope. And what's it? And they have services 7 days. Well, technically 7 days a week, because if you call, you will receive a message on what to do in case they're not there. They're in the office 6 days a week. They're in the community on Jefferson Avenue for behavioral health, mental health, emotional health. That phone number one more time, Melissa, 716.
Yeah, the helpline is 716-250-2478 from 8
Thank
to
you.
6:30.
Sorry. Yeah, and I just want to thank you. And I just want to say, I'm sure we will have you back because you're one of our fabulous community partners, one of our many fabulous.
I appreciate it.
Oh, you're welcome. And next week, you will hear from my esteemed colleague, and that is Cindy Bass from ECMC. And in 2 weeks, you'll hear from myself, that is Francesca Messiah, Kaleida Health, Workforce Development, and Kaleida. Please remember, Kaleida Health is hiring. Come grow with us. Develop your career path with Kaleida Health. And on that note, I'm going to say thank you for listening. Take care. Be safe. Bye-bye.